Are you ready? All right, hello and welcome to our community conversation on mental health and law enforcement breaking the cycle. This discussion is part of a series of community conversations aimed at promoting equity, unity, and inclusivity in the Baraboo area. Thank you for attending this evening, and I also want to thank our local partners, including the Baraboo X Coalition, the Carnegie-Schadde Memorial Public Library in Baraboo, as well as the City of Baraboo Police Department. My name is Jenny Erickson, and I'm a community development educator with UW-Madison Extension here in Sauk County, and tonight I'm going to be the moderator for this tonight's program. A few notes before we launch in. You'll be able to find the recording for this event on the Baraboo Library YouTube page, as well as the recording from our first event. Also, prior to this recording, we solicited questions from the community for our panel, and so we're going to start with those questions tonight. However, there will be some time before we wrap up at 7 p.m. ish. For your questions, but I would ask that you use the Q&A function at the bottom of your screen and not chat. So Q&A is the best way to submit questions to our panelists. Also, kind of a final note, this is a complex issue, right? And tonight we aim to start a conversation, to build some awareness, to build community, our opportunities for community building. We are not going to solve this issue tonight. Or any of the challenges associated with the issue. So expect non-closure. So with that, I want to recognize that we have a powerhouse panel tonight that are bringing a variety of perspectives on mental health and law enforcement. I'm going to ask each of them to just briefly introduce themselves, but also talk about a little bit about their role and their interest in this topic. So I'm going to start with Sarah Jesse. Would you lead us off?
Absolutely. Hi, everyone. Welcome. Thanks so much for coming tonight. I work for Sauk County Public Health, and in my role, I focus on improving community health in the big picture. You know, my burning question is, what can we do to make our communities healthier places to live, learn, work, and play? So what I bring to this panel, I think, is threefold. First, I have some data from surveys and focus groups that we've done this year on community health and how that relates to the topic that we're discussing tonight of diversity and policing and law enforcement and equity. Did I say that? And then second, one of the programs that I've had the pleasure of hosting since 2018 is a week-long training for law enforcement that's really proven to improve interactions between officers and people living with mental health challenges. And then third, I have personal experience in this area, having grown up in a family with a lot of mental health challenges, including a brother with paranoid schizophrenia. So lots of law enforcement interactions based on mental health in my family growing up. So thank you. I'm happy to be here tonight.
How about you, Jared? Were you going to go next?
Hi there, I'm Jared Pierce. I'm the clinical social worker, behavioral health specialist at the jail, the Sauk County Law Enforcement Center, which includes the jail and the Huber Center in Baraboo. My role is basically to provide mental health evaluation of the inmates after they are booked into the jail. I do a lot of focus on crisis intervention and suicide prevention, as follow-up counseling with the inmates and release planning involving treatment planning and getting people connected to community resources. I've been working at the jail for about 4.5 years now. And prior to that, I was working for Alternatives to Incarceration in Dane County. So I've got a background of trying to help keep people out of jail, provide alternatives, and to try to help people find ways to avoid being incarcerated.
Thank you. How about Jessica Mijal?
Good evening. I'm Jessica Mijal. I am the Director of Human Services. I came into that role very recently in August of this year. Prior to that, I was the manager of our Mental Health and Recovery Services unit here, in which I had oversight of our outpatient mental health and substance use services, along with our medication-assisted treatment program, which is a program for individuals affected by opiates or stimulants. Also oversaw adult protective services and had some broad oversight of crisis as well. In my director role, I have oversight of all of the programs under human services. So I'm continuing to grow in my learning of all of those. And I'm here because I really value community input, and I'm really passionate about the mission to serve all of Sauk County residents who come through our doors with quality and effective services. So really seeking to continue to look at ways to make our services in our community more inclusive. Thank you.
Thank you, Jessica. And how about Annette? Are you willing to introduce yourself next?
Sure. Can you hear me okay? Okay. My name is Annette Crowder. I am a parent, step-parent, I guess would be the formal term, of a couple of children who have various mental health issues, including depression, borderline bipolar, just a number of things. I also just in general have had various interactions with the police during my time here. I've lived in the Baraboo, Wisconsin Dells community for the past 22 years. And prior to that, I was in the Madison area and I'm a military brat. Right now I work for Ho-Chunk Tribal Nation and do a lot with the community there, as my husband's a Ho-Chunk tribal member, and I work with the elders and I've worked with the children as well.
Thanks, Annette. And how about our other Jessica Baldauf?
Good evening, I'm Jessica Baldauf. My current title at Sauk County is Crisis Supervisor. I took this role on in January of 2020, although I've been employed at the county for 5.5 years. Prior to becoming Crisis Supervisor, I was a dual diagnosis psychotherapist, seeing individuals with both mental health and substance abuse concerns. Currently, I oversee the crisis program and the medication-assisted treatment program, which is now called Sauk County Recovery Connections. I'm really passionate about suicide prevention, and I'm passionate about connecting individuals to resources in the community.
Excellent, thanks. And last but not least, Chief Schauf.
I can be least. I have no problem with that. Good evening. My name is Mark Schauf. I'm the Chief of Police for the City of Baraboo. I've been the chief for 10 going on 11 years now. I've been in law enforcement 26. As I've been a police officer, I've been fortunate to see what I'm going to refer to as the evolution of law enforcement in some respects. And we're in a dynamic change, law enforcement nationwide, and rightfully so, it's being called for. And one of the big challenges that we have in law enforcement is how we encounter and provide service for people with mental illness. And that's one of the things that I think will help the solution going forward for the entire community and for the nation. And so that's where I sit with the giving you some perspective of what we're dealing with as the police, and giving the community at home the opportunity to see these great professionals, because Sauk County lines up the A team. There's no doubt about that. We have some really talented individuals that are out there trying to provide the best service for the communities. And I think we'll have a great opportunity to share that tonight. I also want people to understand the scope of what we're dealing with and how we, the police, are not the answer. And we know that, and we need help.
Excellent. So as you can see, we have a really a wonderful panel that's bringing lots of different perspectives to this issue. So to start us off tonight, I was going to ask Chief Schauf to just provide a little bit of maybe context, a little bit of data to set the stage for us.
And I don't want to bury everybody in data. So I only have some information from 2020 and 2021, just a little scope of what we're dealing with. So as a police officer, if I were to give you an estimate, I would say that roughly 60% of the police calls that we deal with in the city of Baraboo, the Baraboo Police Department, involve either mental health or substance abuse. Oftentimes we're finding that people who have some mental health issues, either because of their ability, whether it's an equity issue of having access to services and not having health insurance and those kind of things, or whether it's a fear of the stigma of mental health that they don't seek services, that people self-medicate, whether that is with illegal drugs or alcohol. And so about 60% of our calls involve either drugs or alcohol on a regular basis. So kind of contextually, in 2020, the city of Baraboo had 8,010 calls for service. That was somebody picks up the phone and they call the police and they say, I need help with something. Of those 8,010 cases and that's just the city of Baraboo, we had 494 of those that were check welfare type calls. So that could be everything from, hey, we haven't seen the little old lady who lives down the street in a week, somebody needs to check on her, to, hey, I saw this friend of mine was online and he was making statements about wanting to end his life. So those are check welfares is the umbrella that we use that term on. And oftentimes when we get there, we find that there's different things. Sometimes we get there and what started out as a loud music turns into a person who's having a mental issue and they need to have an intervention. Or it could be the exact opposite, where we get there and everything's fine, they just haven't talked to somebody in a while. But in 2020, we also had 44 times when the police had to step in, use our partners at the Department of Human Services, and make an emergency detention. So for the people at home, an emergency detention is the police taking away that person's freedom and putting them in a medical facility so that they can get treatment. That's an emergency detention under 5115 of Wisconsin statutes. Conversely, in 2021, just to give you a number, so we were at 494 check welfares and 44 incidents in all of 2020. In 2021, we've had 5,902 cases as of yesterday. And of that, we've had 488 check welfare type calls, the same type of calls. And we've had 41 incidents where the police department has had to do an emergency detention, or we've had to physically take someone and get them help at a mental health facility. So obviously mental health is a significant portion of what we do. It relates not only to the calls we're responding to, but we had some questions about the violence related to mental health. And it's very difficult for us to quantify that. It's not you just check this box on a report type data collection. So it would require a great deal of data mining that we just don't have time to dig into specifically. But I can tell you, because I've been there, this year I had to help out on a call, and I encountered a gentleman who very obviously had schizophrenia. He had been diagnosed with it, and he just didn't want to take his medication. And some of the things that he was threatening to do were kind of scary and shocking of the conscience, even of an old cop like me that had been doing it for 26 years. I kind of looked down and shook my head and said, wow, this guy needs some help. And luckily we were able to get him to the place where that help can come from. And then I'll let my partners talk about that as we go forward. But from a context, mental health is a big issue for us here in law enforcement, and we can't do it alone. We need the partners that are here on the panel. And that's why I'm excited to talk about this.
Wonderful. Thanks, Mark. At this point, I want to kind of transition a little bit, and we want to start with some kind of personal experiences and personal stories related to this topic. And I know Annette was willing to share some of her experiences in this realm of mental health and law enforcement. So Annette?
Sure. So it's been a little bit, that's the positive part. We started off having experiences where, unfortunately, the police had to come to our home almost on a every other weekly basis, because we had a child that was being physically aggressive with people, as well as trying to get medication regulated through the for his mental health issues. And I would say the hardest part for us as we went through the process of figuring this out is that I felt like not that the police should have all the information, but they weren't given some of the tools that they needed to be more successful with parents. For example, we found out about programs like Katie Beckett years later. And I don't know, how something like that could change, but it seemed like that program and CCS made a huge difference once we understood and were able to get involved in those. But I mean, just having the police at our home on such a regular basis, not only is it trying as a parent to have someone come into your home, on occasion, we had a few occasions where the child had to be removed and taken to an institution after visiting the hospital and verifying that it was a dangerous situation. But we also, I feel like you get a stigma too. You have neighbors around you, and the police are at your house a lot. So that's just I guess a side note of things. For me, just like, oh my God, everyone probably thinks we're like drug dealers, or we're some strange, doing crazy things. We most recently have been dealing a lot with a child that has deep depression issues and suicidal tendencies. We haven't had to utilize the police as much because she's been more cooperative and willing to go to the hospital. So that's been really nice. And from our learned experiences from the other child, we've applied some of those techniques. I guess the most troubling part right now in our life is that there's lots of wait lists, and I know that there's nothing at all that anyone can do to change any of that, but it's there. And so you have a child going back and forwards to an institution, and you have a psychiatrist who's prescribing one way, and an institution, for example, is prescribing the other way, and the two don't talk. And I don't know how to describe it much better than that. It's just that you have one saying, okay, we're going to do this, regulate the medication to try and help with the issue. And then you go back to the psychiatrist and they're like, I don't know why they do that. They don't quite know all of the history. So that's why I just feel like there's a lot of like little gaps in communication. And it starts all the way at the beginning with, or at least for us, it started all the way at the beginning with the police coming into the home to help us. And I just want to reiterate that we greatly appreciated that assistance. The harsh part is that I just felt like the officers didn't know some key things that they should have, possibly been able to pass on, even in just like a pamphlet, like leaving it with a parent or etc. Onto it, I guess, on a separate issue, just myself, as a Black woman here in the community. It was pretty hard at first, I felt like. I don't know how to explain it. Almost every time I got pulled over for something, there was an assumption that I was an out-of-towner. There was never an assumption that maybe I was a community member. It was more like I'm, from some other state or something. So that was a little harsh to deal with. And that just wasn't with the police. I want to make that clear. I mean, we're 2 stores down now, or 2 stores beyond, the festival. But I would go into the grocery store and I'd have someone tell me before I even get my ID or check out that they don't take out of town checks. And I'm like, I'm not from out of town. And I come to this store about every 2 weeks. They get groceries. That was super frustrating for the longest time. And I guess I'll stop there. I mean, I don't want to go into a rant about war or anything like that, but it kind of felt that way sometimes. And I do have, I guess, one other troubling thing for me is, and this one is an older one, terminology that people use. I had an officer stop at my home and say, we received a report that a mulatto boy was walking around barefoot, no shirt, with a dog. And the term mulatto alone threw me for a loop because I think of it as a term from slavery days. I was just like, okay. And I'm like, well, it's not my son. And most people have seen my son. He doesn't he didn't really have a darker skin tone. He was actually born with blonde hair and fairly light skinned. He did have really long hair, because we grew it out over the years, but it was just really weird to have an officer come to my door and say something like that. So I guess that was probably my most, like, made me ball up in tears and like, are we serious here? We don't know, proper terms of how to address someone, or why not just say child versus a mulatto boy? I received a report. So I'll close there. Thank you.
Thank you for sharing that really personal story, Annette. I appreciate that. And so at this point, I'm going to kind of transition into some of the questions that we received from the folks through our survey. And I'm going to start with the first one here. Can you speak to addiction and the war on drugs, and how this has been impacted by equity and inclusion efforts? And I'm going to throw this one to Mark first.
Well, I know that I'm going to end up needing Sarah's backup, so we'll pull her in here before we're done. And let me just start by saying that the war on drugs was something that was a statement made back in the 1980s as we're going to solve this problem. And if you've seen any of the publications, there's some very good books about there. A Wisconsin author, The War on Us, has written about this very issue. There's a lot of very smart people, a lot smarter than I am, that have really looked at this issue from multiple angles. So I don't want to get into the politics of the drug use itself, but what I will focus on is how it impacts locally. So although we really have come a long way to understand that drug use and drug abuse is an addiction, which is a medical issue, we have to find a way that we can help work on that, because the people that live next to those folks that are addicted are suffering because of the types of conduct. And I hear from homes next to known drug houses on a weekly, if not daily basis. And so the war on drugs, maybe it has to shift a little bit and not so much be a war on drugs as it is a war to help fight addiction. I don't know what the answer to that particularly is. That's something that politicians are going to have to figure out at a higher level, because it is going to require money. At the end of the day, all of this comes down to where are we going to have the money to pay for this? It was part of the defund the police conversation, was let's not give money to go out and give more police cars. Let's get some social workers out there. And you know what? I'm actually supportive of some of those ideas. However, we still have to maintain a level of safety and security. And that's where my job comes in, of making sure that we can turn to our friends, like I'm going to do right now with Sara, and say, okay, Sara, help us. So Sara can talk a little bit about the CIT training, which we've had. A third of our police department has been trained in CIT. CIT is the most common new thing. The training that I went through, and I haven't had the chance to go through CIT yet. The training I went through before was called Mental Health First Aid. Again, a similar program. And we've changed names, but the same issues exist, that we have mental health in people that we're dealing with. And what we need from police officers is the understanding that mental health issues exist and finding ways to de-escalate potentially volatile situations. And with that, I'm going to give it over to Sara to.
Wow, so thank you, Mark. And these are two issues I could get on a soapbox for quite a while, both CIT and the war on drugs. I don't know a lot about our statistics at the local level, but I can speak nationally first about the war on drugs. We do know from a public health perspective that all races and ethnic groups use drugs, illegal drugs, at about similar rates. Right? It's not that one racial or ethnic group is using drugs more often or harder drugs necessarily. But what we see nationally is that Black and brown people are caught using drugs a whole lot more. And again, I don't know if this is true in Baraboo. I'd really be interested in those statistics, because typically, and this is again nationally, communities of color tend to be targeted for drug raids a lot more than white suburban areas would be. Now, if white suburban areas were targeted for drug raids, I think they would yield similar results in terms of finding drugs. And again, because this is national and we're talking about the rural community of Baraboo, it's quite different, but I find this is something so necessary to talk about, because once you have that felony stamp on your record from going to prison for drug use, it's so hard for you to get affordable housing, a job. You can't be eligible for a lot of services. You can't vote in elections. It's really a huge stamp that you deal with for the rest of your life. And I know our law enforcement are trying so hard to get people help. And it is really difficult. I've had addiction in my family. My sister died from a drug overdose on OxyContin. So I know how hard it is to try to get someone who is in the throes of addiction into services. And what's the best route to that? Is it to put them in jail for a while? I don't know. It's really tough, Is it to get them help without the criminal justice system being involved? I just know from that national perspective, because that's what I've read up on most, that this is a real big issue, and it has had a really disproportionate effect on people of color. Should I go into CIT, or do we want to talk more about?
I think we kind of started getting into the next question, and I saw it kind of pop up as well. And it's like that. And that question is: does the Baraboo Police Department have any behavioral police officers on staff? And if not, is that something Baraboo PD would consider? And Sarah, do you want to talk a little bit about CIT?
Crisis intervention team training. I would love to. So crisis intervention team training is really an awesome week-long 40-hour training for law enforcement. And it has been proven through evidence to improve the outcomes when law enforcement interacts with people who are living with mental health concerns and challenges. So it's a diversion program. It aims to keep people out of jail and increase the likelihood that they receive the mental health services they need. So CIT trained officers have better outcomes for themselves as well as for the person that they're helping. For example, they're way less likely to be injured on a mental health crisis call. So during this week-long training, they receive an overview of mental health disorders, and they really go a lot into de-escalation techniques. How do you calm a situation down? How do you ask the right questions of people to get the information you need? Like, are you on medication? Have you been taking it recently? Then looking for clues of mental health crises, and then how to respond in the most compassionate way possible to that situation. And what's really neat about this training, we've been able to offer it since 2018. We bring in a professional agency that does the whole training and brings in professional actors who will act out scenarios of mental health crises and work with the officers on their de-escalation techniques. So they do role plays, like hours and hours of role plays during this training. And you can really see, if you observe them, how much better the officers get over the course of the 40-hour period. So we really hope we'll be able to continue this. It's kind of expensive, the training, and some of my funding sources have disappeared that I've managed. I would love to see this kind of training be mandatory for all law enforcement. I really think it should be part of police academy. It is in other states mandatory, so I know none of us here are legislators, but perhaps someone on the call has the ear of a legislator and could bring this up to them, because again, it's evidence-based and it works. And we're hearing 60% of calls for service are mental health related, so completely needed, I think, for all law enforcement to have this training.
Great, wonderful. I'm going to move on to the next question because I see there's lots of questions coming in from our attendees. So this one's going to go to Jessica Baldauf. And so this is a question that came in through our survey. So the person wrote, I recently met someone who was going through a mental health crisis. They were in denial about needing help, but they were not able to be a functioning member of society to the point that they lost their job and home. They were unable to maintain friendships and were threatening others with violence. When I reached out to both police and human services, I was told the person had to come voluntarily unless they were suicidal or homicidal to receive services. This person is now on the streets without a job and in a mental health crisis. how can we do better for our community members? I know that you deal with these kind of crisis situations regularly. Jessica, can you give us some insights on this?
Sure, I can try. So it's partially true that individuals need to be voluntary to seek services at the county. And the reason that we ask for that is so that we have engagement. We value confidentiality, and it's important that individuals call on their own seeking services. We appreciate input from community members, family members who are concerned about community members or citizens, and we do our best to help out as we can. When we hear the word crisis, that can be defined very broadly. And when we reference crisis, we're really talking about individuals who are a danger to themselves or others, meaning that they're suicidal with an active plan or intent to harm themselves with imminency, or they are struggling with thoughts or plans to harm other people. When it doesn't reach that level, we are able to help and assist by connecting individuals to resources after we assess them and evaluate them. And services can look like outpatient counseling, outpatient mental health or substance abuse counseling, an inpatient voluntary hospitalization, or if someone is truly in crisis, we involve law enforcement and we would detain them for their own safety. Individuals who are in the community and are struggling, we are available for walk-in services. We're available via phone, and we'll do all we can to connect them and engage with them, even if they're not interested initially.
Any of our other panelists want to weigh in on this one, or are we ready to move on to the next question?
I guess I would just like to add one thing, and this is going to sound a little cop-ish, but I'll throw it out there anyway. Is people have to realize it's not illegal to have mental illness, and it's not illegal to have a mental problem. Sometimes people, that guy's got to have something wrong, and the police need to haul them away. That's not what we do. And people have to understand what Jessica's talking about, as far as we are taking someone, we're depriving them of their constitutional rights when we put them in a hospital. We're saying you can't be safe by yourself, so we're going to put you in a place where we know you are going to be safe. And there's a bunch of rules called the Constitution that don't let us do that. So we're very careful about doing that from both the police and I know the DHS's perspective, because it's important for us to help, but we have to do so within the confines of what we can do legally. And I'll just share the one example of, we had a subject who was homeless here in Baraboo for years. He would spend his time down on the Riverwalk. He happened to be a vet, and we actually had counseling services, residents, medical services all lined up for him. Everything was set. He would just have to get in a car and ride, and he chose not to. It was his choice, and we couldn't force him to, but he chose not to. Unfortunately, he's no longer around. His medical problems ended up taking his life, but it's a choice that he made to continue, and we can't compel his choice because we are free beings.
Thanks. I'm going to send this next question to Jared, and that is, what percentage of inmates are in need of mental health services, and can you share the programs that have been most successful?
Yeah. We don't actually have data on percentage of inmates that come into the jail that are in need of mental health services. While I do keep data, it's very difficult to analyze that data and compare it to the number of people who come in and out of the jail. People come in and out of jail and get rearrested often. And we don't always keep track of the number of individuals that are booked into the jail. Another factor that makes that difficult is that something that people might not realize is that the Sauk County Jail is also a place where we house inmates from the federal court system and state inmates for the Department of Corrections. I know that in 2020, we had 2,194 people booked into the jail. Let me correct that, 2,194 different bookings into the jail, but we don't have an actual accurate number of how many individuals that includes. As I said, some people get arrested or rearrested multiple times throughout the year, unfortunately. Where I am involved, I was able to manage to keep track of the number of individuals that I did meet with in 2020. And I ended up evaluating or providing follow-up care, counseling, and release planning for 633 different inmates in 2020. And I do know that in 2021, those numbers have increased as well. One thing that kind of skews those numbers for 2020 and for 2021 is the effect of COVID and our quarantine protocols in the jail, where we do need to provide an added element of mental health services to people who are being quarantined when they come in and arrive at the jail. So that does kind of add more contact with providing mental health services. As far as the programs in the jail prior to 2020 and COVID, I was providing a mental health coping skills course. And I found that was pretty successful with the individuals that did participate in it. We do try to also connect people with GED and educational programs, which has been limited in the past couple of years due to COVID, as well as AA, Narcotics Anonymous courses. But other than that, there are not a lot of programs that are offered inside of the jail.
Thank you. Our next question is, was there anything else you wanted to add, Jared?
No, I just wanted to add too that as Sarah Jesse was saying, the crisis intervention trainings, I do know that the Sheriff's Department has participated in that, and I believe there have been a number of both patrol and the jail deputies that have participated in the crisis intervention training that bring that added skill level to the job every day.
Our next question is for both of our Jessicas here, and that is, what are the local resources for mental health treatment, especially for low-income residents?
I can start, and actually I just quickly wanted to piggyback off of what Jared said and just mention that Sauk County is part of a consortium that recently received a sizable grant across a 3-year period of time that's focused on prevention, treatment, and recovery within the Sauk County, within Sauk County. And so there are a large number of us as part of that consortium that are looking at the various needs. And one of those needs identified would be to have a reentry coordinator position at the jail that would really work with individuals who are being released to connect to treatment, to resources, to do education about overdose risk. So for instance, if somebody's been off substances for a period of time while in jail, then their overdose risk goes up if they resume their previous level of use. So that person would have a number of roles and would support the work that Jared's doing. Jared's a one-man show over there, and he's very busy. So this would really help to support individuals and hopefully help to do some more interruption of that cycle of individuals who leave the jail and reoffend, oftentimes due to their use. So I did just want to mention that. And then in terms of services, and Jessica can jump in here too, Sauk County Human Services, we are an open door for any resident of Sauk County who is seeking assistance with their mental health or substance use. They can, when people first come to us, we meet with them, we try to understand their needs. We talk with them about options for treatment, either with us at Human Services or out in their communities. And oftentimes those decisions are made based on preference, insurance, transportation, and a variety of other factors. We are an option. I would say probably 90% of the individuals that we work with are on Medicaid. And so we try to reserve ourselves for working with individuals who are on Medicaid or uninsured or underinsured. Private providers don't have that capacity due to being for profit. So they oftentimes limit the number of Medicaid or uninsured individuals they'll work with. And so we have the ability to offer a sliding fee scale based on ability to pay. We can offer low cost payment plans. So we just say, come through our doors, talk with us about what you're in need of, and let us work with you to figure out how to best resource it based on your needs and concerns.
Jessica, did you have anything you want to add?
I'll just say we have an outpatient mental health clinic where we offer outpatient mental health and substance abuse counseling services. We offer crisis services, which can also include following up and checking in with individuals while they're waiting to get into services. We also offer, as I mentioned before, the medication assisted treatment program for individuals who are struggling with opiate or stimulant abuse disorders. That's a wraparound program. Individuals can come to us who are voluntary and seeking community-based recovery and support with their addiction.
So I just wanted to remind folks that are on the line, if you have questions for our panelists, please submit them through the Q&A function, and then we will get to those in just a bit. I just have a few questions left from our survey. So this one's for Mark and Sara. Again, someone submitted this, and I'll read what they shared with us. It says, as a school social worker here in the Baraboo School District, I would like to hear how the Baraboo Police Department envisions future collaboration for prevention efforts regarding student family mental health issues and social inequities within our community. So Mark, do you want to lead off on that, or Sara, Jesse? Who would like to take that one first?
I can start. It's a big question, but it's also a big problem. And so we are working towards, the first step we've taken is both of the school resource officers have received the CIT training working with Sara and her team. They've received additional other trainings as well and served on different review panels with our friends at DHS as we deal with the issues related to mental health and or juvenile justice or children in need of services. We find a lot of the young kids that are getting in trouble, juvenile justice, have other things that are contributing to why they're acting out, why they're having problems. And so we've gotten better at working with our DHS partners to try and find services for those families. And it's not always easy. Sometimes the school is the strongest and most loving place that those kids get because mom and dad, because they're dealing with their own mental health issues, don't seem to be as present as we would like them to be for those kids. So that's one of our challenges. And again, I think I've said this a couple of times, but I reiterate it now. We as the police can't do this alone. We need help. And we understand that we're here 24/7 and we're the easy call. We're the only people you can get a hold of on a 3-digit number, 911, and we're on our way. That being said, we're not as well equipped. We're better equipped than we used to be, but we're not as well equipped to handle these situations. And so we need help. We need help from others. And one of the things I think we'll resolve or talk a little bit here about is some of the challenges we have statewide, because this isn't a Baraboo problem. This isn't a Sauk County problem. This is a United States problem. And because it's all over, we all can be doing better from a law enforcement standpoint. We can all be doing better to serve our community and those needs and that evolution going forward. So we've trained our staff. We're working partners with our friends at DHS, and they're the ones with the alphabet behind their name. I'm just a dumb cop. Those people understand all of the services. They're the ones that we're going to call and get help from there. But even as Annette had started in our conversation here, getting our officers to know a little bit more about some of the resources available has been one of our pushes. And we're getting better. We're not perfect. We're getting better. And I guess I'll hand it off to Sara to comment further.
Thank you. Well, I think just like law enforcement gets a lot handed to them, schools also get a ton handed to them. And I guess right now I can't speak to solutions as much as I can speak to some pretty alarming data that we have seen on the Department of Public Instruction website for the Baraboo School District. It just seems that economically disadvantaged students are being disciplined at much higher rates than non-economically disadvantaged students. And in the Baraboo School District, it is about half and half economically advantaged or disadvantaged and non-disadvantaged students. But the data that I saw when I looked at it this week, the most recent was 2019-20 school year, and economically disadvantaged students had a 14% rate of disciplinary action, and that's like in school, out of school suspensions. There were no expulsions, which is great, but that was 7 times more than the 2% rate for non-economically disadvantaged students. So I don't know how much law enforcement, has to do with that, but we hear a lot about how issues sometimes start in the school transition to maybe criminal justice involved individuals later in life. And just wanted to point it out as an issue I think we should all be aware of, because it wasn't just one single year. And it's not seen as much in our other school districts in Sauk County. So I don't know if anyone has any more information on that or feedback on why that might be. It's just something that we're concerned about as an equity issue.
Part of that I can speak to a little bit, because we've dealt with some of this with the police, is that Baraboo has a relatively uniquely high socio-disadvantaged population. We have one of our schools that's well over 70% free and reduced lunch for the state of Wisconsin. Overall, district-wide, it's more than 50% that are socially, economically depressed. And it is a very significant contributing factor, just the way that race and some of those other things are contributing factors as well. When you don't know where your next meal's coming from, it's very difficult. When mom or dad don't know if they're going to be able to pay the rent, it's very difficult. And those kids have a much more difficult time being successful in the school district. And we see that not only from the school resource officers having contact, but even the times that we have to have contact with parents at the elementary levels.
Well, this next question is also from Mark. How is the mental health of the Baraboo PD staff assessed and monitored? What kind of services are your staff able to access?
Well, from a staff perspective, when you're hired as a police officer with the Baraboo Police Department, you have to go through a psychological exam. We utilize a company down in Madison to do that, and they do a series of tests. Anybody who's in the field remembers the old MMPI. I've taken that thing way more times than I'd like to admit. So they take a series of tests and then interview with a professional psychologist to tell us, and then we get a report back. Not only do they say this person is qualified to be a police officer, but they provide us with potential trip hazards for that officer based on things that the psychologist gets throughout the interview. As you go through the career, then we do have crisis intervention. And I'm going to take a moment to tout 2 incredible individuals in my department that are very, very new. Catherine Finger and Ernest Finkla are chaplains. We actually started a chaplain program a couple of years ago, and it really is just taking traction fairly recently. And these 2 very loving individuals have taken it upon themselves to volunteer their time and talent, and have provided not only a place for the police officers when dealing with a critical incident to have someone to talk to and evaluate, but we've been able to bring them in and help victims of pretty horrendous things that have happened and they're able to be supportive there. So it's just one more layer of mental health awareness. So beyond that, if we have an officer who is observed to be suffering from some nature of, we call it fitness for duty, are they able to mentally do their job? If they're not, we have practices and policies in place to activate. And I unfortunately have had to do that over the years. I've had to do that more than once over the years. A couple of former police officers had to leave because they just weren't fit to do this because of the toll that things have taken on them. So we do have plans in place to provide support services and move forward with things. But there is no ongoing psychological exam beyond that unless we need it. And when we do have those really tragic cases, we do provide one-on-one personal, and the city also has EAP, employee assistance programs, that allow for counseling and those other things at the need of the police officers.
Well, as we've heard tonight, there's a lot of challenges associated with all of these issues, but I want to end on, before we open it up to the questions from folks on the line here, I wanted to end with kind of a positive note. And so I'm going to circle back to Annette here, and I'm going to ask her to start us off, but where do you see some opportunities moving forward? What more could be done? How can other interested folks get involved? So whatever piece of that you want to take on, Annette, where do you see some opportunities ahead?
I think one of the biggest things is just making sure that the officers are aware of resources that are available within the community. Because you do have people on both ends. You have the students that, the kids that don't have finances or insurance and things like that. This is going to sound a little weird, but at times I feel like, that might be a little bit easier to solve. Or in our case, we had insurance, but we couldn't access the type of resources we needed, which is why we needed to get involved with signing up for like Katie Beckett, for example, because we needed more of a wraparound approach to help the kids out. I guess other areas is just
Annette, you mentioned Katie Beckett a couple of times. Can you just briefly describe what that is?
Sure. My understanding of it, it's basically a program that allows you to, if you're considered to be higher income or just above, that certain level, it allows you to still be able to access county resources if you're approved. I can't remember if it's considered Medicare or Medicaid or anything like that, but the way I associate it is that I have my own personal insurance, but because I can afford that personal insurance, I can't utilize any of the Sauk, just the county resources. So by having my child be able to get approved for Katie Beckett, I was able to access the county resources. And with a county like ours, where we're not like Dane County, there's a lot less choices. And so being able to access the county resources seemed to make a better difference for us, being able to get the school district involved, a police officer or a resource officer, and just other programming opportunities that Sauk County has that our local providers don't have available to them.
Sure. And I didn't mean to get off subject. I wanted to.
Oh no, that's okay.
Where do you see some opportunities? Where can we go from here?
I think right now we're headed in a good direction. We need to find funding to do more. Personally, my biggest issue right now is trying to find groups for like a teenager to be able to talk to other teens about their struggles and their issues, so that my teenager doesn't feel like no one understands them, no one can relate to them. And we just don't seem to have that available in our community or in Sauk County, or at least not that I'm aware of. And I've looked at the what is it, NAMI, I think it's called. I talked to them recently and they said, we're sorry, but we don't have anything for youth. And if we're gonna, I understand that the adults need a lot of help, but the kids need it too, because they grow into adults, I guess is the main thing I wanted to point out. And there's just things that we could do to maybe change their path or make it where they see themselves as a possible college graduate and so on in the future. And I'll just stop there.
Thanks, Annette. Any of our other panelists want to weigh in on where they see some opportunities ahead?
Well, we certainly have an opportunity right now as a community in that Sauk County Public Health and our 3 area healthcare systems are working together on a community health assessment that we're just wrapping up now. We did a survey and focus groups about community health. Now, these surveys, focus groups, data collection in the past have always led us to prioritize mental health in our community to work on, as well as substance use. In the past, we've prioritized things like dental health care as well, and sometimes healthy eating and physical activity. So if people want to get involved, I can't tell you exactly what direction we're going in this cycle, but I would say so far, mental health and substance use disorder are certainly rising to the top of everybody's minds. Equity is very much in line with our mission as a health department, and our hospitals are on board with that as well, looking at disparities in health, where our health opportunities unequal in our community. We're looking a lot too at socioeconomic factors, things like employment, housing, social connectedness in our community and how that could be better, as well as adverse childhood experiences that we know that's childhood trauma that then relates later to a whole host of mental health, physical health issues. Also lower income, people who grow up with a lot of childhood trauma have a lower income as well. So if you would like to join us, please contact me, because it's a great time to get on board for that prioritization, focusing, what should we focus on, as well as taking some action. And I have to say, there was a question in the chat too about mental health related grants. I have been fortunate to apply for lots of substance use disorder related grants, and we brought a lot of money into the community through those, thankfully, not just mine, of course. Human Services has applied for these grants as well. I haven't seen that much in terms of mental health related grants that relate to community health. And I know another question out there is, what's the role of healthcare in this? Everyone knows it's a huge problem, but what are we doing about it? And now I've worked in suicide prevention for Columbia County for many years, and I know we can all educate ourselves on signs and symptoms and be ready to respond with resources. And that's great, but we need to do more than that. I think our healthcare systems could do a lot better job screening people for mental health challenges, and not just screening them, but then appropriately following up with them with motivational interviewing, maybe for people who aren't clinically depressed, but are really struggling with their mental health, or, don't have a diagnosis, but still are feeling pretty bad. How can we help them, move them forward to a better place? How can we refer people who do need the help appropriately? There's just so much that we could do as a community. So love to see more people join us in that. We're very open to collaborating with community input. It's really at the heart of what we do. I've thrown out one idea for what the state can do is, put that CIT training into police academy. I also think that law enforcement, to have our law enforcement transport people to mental health institutions when there is an emergency detention is a huge, it's a huge, so hard for law enforcement. It takes them 12 hours plus sometimes for medical clearance, and then transporting to Winnebago, waiting, coming back. In other states, this is not the job of law enforcement. And I would love to look more into that. I know, for example, in Minnesota, it's a healthcare issue because it's a healthcare problem when you have a mental health challenge. So law enforcement gets to just drop people off at a hospital or healthcare setting and say, here you go, you handle the emergency detention. And then the person doesn't have to sit in handcuffs when really they're just very depressed, And I know law enforcement has to do things like that, but I see Chief Schauf nodding his head. I think he'd agree. Like, it's just not good for anybody, I think, for people to be transported this way as the only way they can be transported.
Thank you, Sarah. I'm going to transition to some of the questions we're getting through the Q&A. The first one is, I have a neighbor who has dementia/Alzheimer's, and her husband cannot find a facility to take her because she is combative. Police have been called multiple times, but the system does not seem to have a protocol for someone like her. She is a danger to herself and others, but that doesn't seem to get her where she needs to go. Who would like to take this one?
I can start maybe, and Chief Schauf, if you want to weigh in. I guess I just want to say it's a tricky situation and a growing need in our community with our aging population. And so I know from a crisis perspective, we are being called to assess more of these types of situations. And I would suspect that law enforcement is seeing more of these situations as well. There are laws that direct how we can intervene and not intervene. And there is a law surrounding individuals with diagnoses of dementia, Alzheimer's, that do not allow us to emergently detain them if that is the issue that is driving their behavior. In order to take somebody into custody under an emergency detention, they have to have they have to be believed to have a treatable mental illness or drug dependency. And Alzheimer's dementia does not fall under that category. So for us to detain somebody would actually be illegal. That said, we're always willing to assess situations. Sometimes things change. We do have an adult protective services unit within the county, and a referral can be made to that unit at any point in time. And at a minimum, they will call to assess and decide whether that case can be screened in and whether they can assist with resourcing it. So I would say continue to call, but I can appreciate the frustration in not being able to go down the path that seems like it would be rational, but we don't have a legal way to get there. Chief Schauf, anything you would add?
Dementia is rapidly growing. We see it on a regular basis. And it's scary. We talk about mental health and we talk about violence related. When you have a couple that have been married for 50 years and suddenly maybe the man has dementia and now his wife of 50 years, he doesn't recognize and sees that particular person as a sudden threat. And it's scary. It's scary for the families. It's scary for the police. I can tell you, having had to do this, walking into that situation and having I had a 90-year-old woman punch me in the face. I probably deserved it, but it's just very difficult for us, and we don't want to have to go in and restrain or any of those other things, but this is one of those opportunities out there. And I'll say opportunity because I don't have an answer. And I know that our partners at DHS don't have an answer. It's difficult. We handle each case, trying to get the resources and the services that the person can as much as they can. I know that the VA, the vets, are working hard at trying to come up with some solutions because it seems like there's an inordinate amount of veterans that end up with dementia type issues. So I know that the VA is trying to do some things, but government moves slow.
Speaking of difficult questions, I got another one for you. It says, prior to retirement, I worked in healthcare for more than 38 years. Everyone I know in healthcare acknowledges that we need more resources for mental health issues, but no one, also acknowledges that no one seems to want to pay for it. What can we do as a community to advocate to get funds to treat this issue?
Any funds from either the state or federal level have to come from the people that hold the office down in Madison or over in DC. Plain and simple. It seems like when something like a hurricane or something like that comes through, we can come through with millions of dollars, and those people need that money, absolutely. But we have a hurricane of mental illness that's going through our community that we're not really approaching the way we have with others. So for anybody who's listening, you start by advocating at your state. You can advocate at the county level. What I can tell you from experience, Sauk County cares. I work with the specifically the two women with DHS that are on this call on a regular basis. It isn't for lack of love and caring. It's just sometimes our hands are a little bit tied. But if you want to do something, you want, hey, I need an action step. Your action step is to first acknowledge that the problem exists, and you're listening tonight, so that's a great start. But then we go to, hey, what can we be doing better at the state of Wisconsin? Does anybody realize that about 10 years ago, they basically cut out most mental health funding and shut down the state hospital so that the state could use it for Department of Corrections? That happened. And those kind of things take away the resources from the general public and supplied it to the Department of Corrections. So it's those kind of things. And I guess the other part of this that I would show from a financial standpoint. So when we detain someone, Sara had mentioned how we then have to take them to a hospital. I'm just going to list off the hospitals that we've driven people to this year. In 2021, we've driven people to Winnebago up in Oshkosh, UW-Madison, Rogers Memorial in Brown Deer, Meriter Hospital in Madison, St. Mary's Hospital in Madison, Willow Creek in Green Bay, Rogers Memorial Oconomowoc, Watertown Regional in Madison, and Tellurian in Madison. So that's all over the state, but these people need help and we have to get them there. And as Sara said, those people are now traveling in handcuffs to get there. That's a long way to ride in handcuffs. But so I guess I don't have the answer, but we have to start with love, and we have to start with realizing that we can make a difference. And if we love our neighbors and our community enough to make that difference, we can start letting other people know that there's a shortfall and see what we can all do together.
Thanks, Chief Schauf. Anyone else want to weigh in on that before we move on?
I guess I just want to name, not to make the problem bigger, but I'll say it anyway, which is, treatment is important, and sometimes hospitalizations and detaining people involuntarily is important for safety. But we have to recognize that the larger issues surrounding somebody's mental health and substance use. And I would just say, we can work with somebody to go into a 30-day residential treatment program, and they come back out and they have nowhere to live. They have no safe place to live that is supportive of their recovery. And so until we really address the housing issues in our county, we're starting at a deficit. And so I would just say, to Chief Schauf's point, we care deeply. Like we want to see people get help and get better and sustain recovery. And it feels like an uphill battle when we're putting people back out into the community in ways that are not safe and are not supportive of the recovery. And that's housing, that's employment, that's having a recovery community that is strong and provides opportunities for connection and growth. And so there are a lot of needs. So I hate to be Debbie Downer, but it is the reality of what we're working with. I believe in treatment, and I believe that people need to have resources around them to support it.
I think our last, sorry, go ahead, Annette.
I was just gonna piggyback on what Jessica was saying and Captain Shaw, and mention that the children also need recovery resources and ALDA assistance. And, a lot of times they, go into the juvenile system or into some other type of foster care to deal with the issue. And then when they come back, they're still dealing with the home issue of ALDA. And then I feel like a lot of the kids just started back up again. So I guess I just want to make sure that we don't forget about the kids, because it's just going to continue the cycle.
So I think our last question is not really a question, but a comment. And so I don't know if you want to react to it, but here is the comment. It says, there's a very large economic chasm that is apparent in our community. This is not only financial, but also has deep ties to equity and bias in our community. I think we could investigate the roots of this bias and inequity, as well as racism that is definitely influencing the behaviors of both our kids as well as our adults. Especially for our young people of color to manage these feelings, which manifest into the mental health issues we are seeing now. Any reactions to that comment?
As a parent, I would agree. I mean, my kids don't actually go to school in this district because of an issue that we had when our child was in kindergarten. Each day we would drop him off to school. And at some point, I think about 2-3 months into the school year, we received a letter with a bunch of check marks on it. And I don't think that's something that goes on anymore, but a bunch of check marks on it, not a personal call, not a, dropping off my kid and someone's talking to me about situations that they're experiencing with them. That's how early on we noticed that there were some mental health possibilities with the child. So I think it's just a communication issue and, figuring out how to all work together.
I would agree as well. And I can say with the community survey that we conducted this year, the 3 hospitals and Sauk County Public Health, we asked a question about discrimination. And we found that 3 out of 4 people of color said that they always, usually, or sometimes experience discrimination in their community, which is a lot. That's compared to, let's see, 14% of people who identified as white. So 3 and 4 people of color who took the survey. They said that, let's see, the situations in which they experienced discrimination, the number 1 response was in public places like parks and on the streets. 98 people said that they experienced that, followed closely by when shopping at stores or dining out, then at work and at school. I did highlight just for tonight that 37 survey respondents said they experienced discrimination when interacting with law enforcement, and this was fewer than the number of people who said they experienced it when interacting with other government officials. And hopefully they interact more often with government officials than with law enforcement in their lives. But just wanted to provide that context that discrimination is very real in this area, based on socioeconomic status, on race, skin color, on sexual orientation. So it's something we all need to keep in mind.
Well, sorry, go ahead.
Sorry, no, that was it. Keeping it in mind isn't enough. Like, we have to do more. I just didn't want to end on that. Thanks.
Well, I want to thank everyone who was able to participate, all of our attendees who were able to participate today, everyone watching on Facebook Live. I also want to thank all of our panelists for just the insights and knowledge and experience that they shared with us tonight. So thank you to all. Thank you to all of you as well. Before we close this thing down, is there any final comments from the panelists before we wrap up tonight? Last chance. Feeling good?
I just
all right.
Say thank you for inviting me to be a part of this.
Wonderful. All right. Well, thank you, everyone. I'm gonna I wish everyone a great night and hope you can join us on another conversation in the future. Thank you.